And I'm going to do this to you.
Oh, are those the new Apple Vision Pros?
They are. Let me find the button. There we go.
Oh, wow. That's amazing. How'd you get
That's
your hands on them?
so we don't even need any other intro to the show, buddy. I mean, all we got to do is show those sweet bad boys. Everybody, you can buy those for what are they? $5,000, $3,500 a pop.
Yeah.
And those are the Zane Kevin Pros, and those are coming out really soon. Just kidding. We're so excited to see you guys. It's Kevin and Zane from RPH Ally, and we're gonna hit the reel, and we're gonna get into a fun conversation about augmented reality, virtual reality, and all the implications inside of healthcare. Talk to you guys in a sec.
You guys changed up your intro a little bit.
That's right, buddy. I got to change up our intro, right? And hopefully, with that beat, we can change the beat from Google Glass, because at least for me, Zane, Google Glass was going to be huge. Like, I was like, this is going to change the way that we do life. Like, we are going to have these on. I mean, going down the road looking for somewhere to eat, and then all of a sudden we'll say in 50 miles you're going to turn to the right instead of my navigation on my phone. I'm going to know where it is. I'm going to be going hiking. I'm going to look at the horizon. I'm going to know every single mountain and peak that I'm looking at and the direction I'm supposed to go on a trail, and recommended, like, this direction is more fun than this direction during this time of year. I thought there's so many cool, just regular world applications. And I don't have a pair of Google Glass like on my head right now, Zane.
Yeah, I remember when Google Glass got announced, and I was super excited. I even put my name down to be like a beta tester for it. Obviously, I didn't get picked. I was in college at the time, I think, yeah. So I do think that we're gonna get to that point. I think Google Glass came out too early. It was way too early for its time. And actually, I was up till last year, there was a company that was using Google Glass. So Google Glass shut down their consumer start. They still had their enterprise side. I think they still might, or they're closing it down. I can't remember. But so yeah, they would do transcription via Google Glass, because obviously it's a microphone, and then so that there was still utility to it. But yeah, man, I think it was way too early. And what you described is exactly what they were wanting to do, right? They wanted it to be implemented in the real world. But I think what got Google Glass the most was just the way it looked. It just looked weird. I think that, I mean, I'm a glasses wearer, even though I'm not wearing them right now. But I think that if they had the glasses, like a normal pair of glasses, kind of like what Snapchat did with their glasses, it would have been more. I think it would have been more adopted, but it just, I think the technology at the time didn't exist for them to do something like that. And I think that's one of the reasons why it failed. It just was just kind of a niche product that looked really weird. So you couldn't really hide the fact that you're trying it, and everyone would ask you, and you look kind of weird like wearing it. And I think that's kind of why. And the first iteration of Google Glass was actually not that small. It's much smaller than the Apple Vision Pro and all the Meta thing, but yeah.
No, let's hear more about that, buddy. But I think, at your point, aesthetics is an interesting thing, like comfort level and usability when you're leveraging technology that is a wearable is big. I mean, if we're talking about a ring, if we're talking about a wristband, whatever it might be, and that's the exact same thing if we're going to augment, reality through visual perception and audio perception. And so some of those things I think were amiss at the time, and just didn't get to the phase where they needed to be. I've talked to or consulted with a couple different companies that are doing things in that kind of space, Zane, and I'm sure you've talked to a few folks too, and that same thing, like their technology right now is fairly rudimentary, and they're looking to be able to advance it. And part of that is the aesthetics, like how wearable is it, leverageable is it inside of space. So what are your thoughts then on the big Apple announcement? Like, it's been a big buzz around, I think, healthcare and tech with this coming out. What is it talking about doing? What features have you seen that it has so far? What are your thoughts overall?
I think the product itself, just like every Apple product, is really polished. Everything I'm reading, it's like the best experience in terms of, I mean, it blows the Meta device, apparently blows the Meta device out of the water. They have 4K screens in there. The functionality is insane. The eye tracking is insane from what I hear. Also, Meta is like half the price. I think Meta glasses are at $1,500, and this one is obviously $3,500. I think in terms of like the usability in the medical side, I don't think Because the nice thing, so the difference between VR and AR, right? I think we should touch on that first. So VR is virtual reality, so it's a literally what it sounds like. An environment is being created for you that's not real. You're not interacting with your real world environment. AR is kind of like a pass through, so it's showing you what's already there, and it's it's like kind of superimposing like applications or words or kind of what Kevin was saying, hey, turn right here onto your real world environment. And the way Apple is doing it is they're kind of digitizing your environment and showing it to you with all the cameras. And they just have like really high, like they have 4K screens showing you. So you're not physically looking at the environment. So that there's like a video pass through that's coming through.
Yep.
And then so that's how they're achieving like the AR, like XR, like whatever thing, right? It can be VR and AR. But I think what this will end up being, to answer your initial question about healthcare, there are areas where it could be great for healthcare, right? For not documentation, sorry, for like education purposes, right? You're trying to teach a patient to use a device. Okay, put on an AR headset or VR headset, and they're interacting with the device, and it's showing them exactly what button do they push this button, all that stuff, all the error messages that are right, or they're injecting themselves, right? You showed, in the VR world or AR world, you're showing them all this stuff, right? Or even like you map out their house and you're like, from an OT standpoint, if the patient can go home, hey, can you climb up these stairs? Can you do this? Can you walk over this threshold, right? Like those are areas where I think AR and VR can work. But for it to be used for like documentation and all the other stuff that that it's really able to do, I mean, imagine you as a doctor walking in with this headset on, like it's just not going to be, you're not present in the moment, right? Yeah. I mean, it's exactly, it's going to look as ridiculous as that, right? So I think it's far away. It going back to the Google Glass thing, right? Aesthetically, it has to look like nothing is there because it's going to be distracting the patient, right? When you're talking to the patient, you want to make them feel like you're listening to them. They're the only person in the room. You don't want them to be thinking like, what the hell is on this guy's face, right? Um, but I do think what it's going to be for like content consumption. It's great for like everything I've heard. Like it's an immersive experience. Productivity at home maybe it'd be great too, but it's going to be a content machine, and I think that the content side of it can be utilized in healthcare for sure at the way it's going to be coming out. But that's just my thought on it.
Yeah, I'm with you. I think that, when we look at some of the things that are out there in the market or are being leveraged, like this graphic shows here, you know, navigation, like simple navigation in a hospital setting, like, do I see that being something that this will necessarily offer? No, like, I don't see this something that someone's going to wear in public, and be able to help them walk around and navigate an individual hospital setting. Just not going to happen. You'd probably have something closer to the good old Pokemon Go that would probably be a better utilization and leveraging of having our screens that are on our phones already tell us where to go, right? And
Or
we
even smartwatches, right? Like
same.
this is one thing that I'm sure people have done this, but I don't know why. Like hospitals should map their whole hospital out, and you should be able to put in the doctor's name or whatever, or the surgery suite, type it in, and it should just like guide you through the hospital. But besides the point, kind of going to but yeah, I don't think you're. But yeah, like you said, we have phones, we have watches, all these things that can kind of do that part.
Not going to happen there. But when it comes to the education stuff, like you're saying, medical education, like pharma and marketing education, like I can still remember like sitting down with patients and me literally drawing something to show them like, here's what your blood does. Here's how your heart pumps. Here's how vessels move, to talk about hypertension, right? But if I can have them put on a headset and be able to walk through with them, like this is what is happening in your body, this is what the medication does, that I can see being very impactful to an individual to see and showcase something in a very visual kind of setting. I mean, it goes back to good old Magic School Bus. Do you remember those days, Zane? The old Magic School Bus? Like getting someone in the place of what is kind of happening or what we're theorizing is happening, probably more often in the world of medicine today, is something I think makes sense. That translates really well to the surgical applications that are already being done, that we can overlay things on a person's body to be able to help with an individual surgery. And some of the cool things that I think, here you might not have noticed, but pain management. One thing that can be done inside of pain management that I've read about is not necessarily just to deal with like physical therapy, which is a very helpful and utilized, element of virtual reality or augmented reality. And we're talking about range of motion and going through these physical steps, but pain management when it comes to taking someone out of reality, to allow them to have a different experience and avoid thinking about pain pathways and pain signals, I think is a really interesting kind of next take. The only other things I was going to say, buddy, so that is I looked through all the FDA like documentation when it comes to what's currently like on the market for medical devices. I would say it was at least 90% of the ones that are currently available are orthopedic. Some of the interesting ones that I saw were related to pain management, physical therapy, and visual tracking, like some ophthalmic, things that are being utilized. But there were the things that I currently saw, kind of out on the market. Give me this, buddy. Let's dream big. What would you love for augmented reality to be able to do?
I think that, I mean, you put out a great number of things. I think for me, augmented reality would just be that it's augmenting reality. Sorry, I was trying to look up the term for pain management, where it's like a psychological treatment. I can't think of the name right now, but that's probably where these could be really used really well. Um, but yeah, I think like just augmenting your reality. I think that's the point. Like Pokemon Go is a great example, right? And I think that that really not democratized, but it showed people what augmented reality can be and can do. Like imagine Pokemon Go, but now you're just wearing glasses that are just inconspicuous. No one can really tell what's going on, and you're just walking through your life. And you know, like I was I was listening to this show, and this is not. It's kind of like augmented reality, but this is just a use case for something like this, right? It was for deaf people, right? You know, people hard of hearing, and
Mhm.
they had created a module that retrofits on any glasses, right? And what
Yep.
it does is it'll like if somebody's talking to me, it'll just transcribe that using AI, and it'll show you, and you can read it, and then you can, because not everyone can read lips, or if it's like weird or whatever, like it's hard for everyone to read lips.
Right.
So that's like one. So that's kind of an augmented reality thing, right? Like you have a pair of glasses, you have somebody who's hearing impaired, and they're able to live their life in a normal way, right? Like in not, I shouldn't say normal. That's not a good word. Not good to use, but in the sense that they're able, the people, they can walk around the world without people knowing that they're hearing impaired, because they're able to like read off their glasses, and no one can see this, right? It's only them, and that's it. And then like the whole direction thing, right? Walking through life with that. I think that there are amazing examples. There's great use cases, but the technology just isn't there for market adoption, like mass appeal market adoption, right? Like it's not going to be like your next iPhone or anything like that, right? Like things have to get small enough for people to view them as usable, right? And also cheap enough, right? They have to get to a point where they're cheap enough. I mean, remember the first iPhone when it came out, like no one could really afford it, but like now everyone and their kid has an iPhone, right? So there's a, an economy of scale that needs to occur with these devices, and also shrinking of them, which will happen over time, obviously, right? So um
What could you see, like Zane, when we're talking about, let's say, go back to the oncology kind of world, when you're working in different roles in the oncology space, if you were able to say, I would have loved to use augmented reality for this, what would you have done, or how would you have leveraged it inside of your previous setting?
education, walking them through, you just be like, hey, this is, I mean, just showing them like, hey, this is, we're going into a surgery suite, this is what the surgery suite looks like, just like simple things like that, just like calming the patient down, like, hey, this is the environment you're going to be in, hey, this is, and then just education wise, right, like using enoxaparin, which is a widely used injection, or any injection, right? Which I can't think of it. Pegfilgrastim. I can't think of the brand. Neulasta.
Yep.
Showing them, because the first treatment, a lot of insurances are like, oh, you have to self-inject. Not everyone wants to self-inject. They don't know how to self-inject. And then when you're showing them, you're using this like fake needle that has a one time. It's only a one-time use, right?
Yep.
And if they kind of mess up, you kind of lost it. But with AR and VR, you can continuously be using it, because you don't have any disposable things, right? Like it's reload grab another needle from the box. Let's try it again. Grab another needle from the box, right? And you just, until the patient has the dexterity, they have the dexterity, they know they have the knowledge, and they can do it at home, and also will ease them, right? Because they've literally physically interacted with the device or the syringe itself. Like those are like the education side of it is where I think it can make the biggest impact, because I think even if you don't understand the language properly, like English is your second language, you
Sure.
might be older and you're a little slow in terms of maybe you can't handle all this, because we're also throwing a lot of information at you, but most people will remember an experience, right? So if we can walk them through an experience, they're going to go home less scared, less, antsy, right? And I think that's where I'm really excited about AR and VR, is from the education piece, the content piece, and all this stuff. And then also, environmentally, like we don't have to waste all these things, right? We don't have to constantly be like sending, having like all these like, practice syringes and these like one-time use things all over the place. So there's less waste too, right? So that and I kind of mentioned it before, like from the OT standpoint, like discharge counseling and things like that. Can the patient walk around their house? Can they take steps? Can they do that? Can they do all this? Can they do their activities of daily living? Like, you can walk through those kind of things in an AR, VR environment. Even if you're a small hospital and you don't have, a rehab area, you can at least have a pair of glasses and walk the patient through these activities, right? So it's opening up the door for people that may not have had that option to them.
I love that. I mean, I think that the guiding elements of being able to give someone a higher level of comfort with a new facility or with a new principle or a practice, like that on an augmented reality standpoint, so much better than fake practice. Like you can't poke an orange enough times to be able to know like how it actually is, and to be able to showcase that when someone is doing it live. For example, if someone is giving themselves their first insulin shot, or they're trying to put a continuous glucose monitor in, like to be able to use that device, or if it's an insulin infusion or an insulin pen or whatever the case may be. Like now you can literally in real time be looking through someone's eyes and lay that out for them, or you can set it up so they can be more successful with landmarks and everything else related to where they're going to put the injection for higher levels of safety, efficacy, whatever the case is. And then, to borrow from a few things that I was just reading over here on the Medical Futurist, really interesting follow if you guys are interested in this space, like Zane and I are. But some of the uses that they talk about, and I'd love to hear, like, we'll play a game. I'll give his example, and then you give me the parallel example that you can see in the pharmacy world. Okay, so augmented reality can save lives by showing defibrillators nearby. So basically, like showing you're walking and now you can see where the nearest defibrillator is. What's your thought on that kind of technology in the pharmacy space?
I mean, if you're looking for a medication, right? Like if you're trying to find a specific medication, you say, "Hey, find me," I don't know, I'm just making this up. We'll just go Neulasta, right? I know it's in the fridge somewhere, and everything is mapped out in your computer system, and it tells you, "Hey, it's on shelf 3, row 2 or something," right? And you look down, it just starts highlighting red, like, "Oh, there it is," that's where it's supposed to be. Like that's an example right there, right? Just inventory management, just finding something in the inventory.
I love that. How about this one? It goes back to good old Google Glass, but basically having augmented reality help new mothers that might be struggling with breastfeeding, like the latching process and leveraging it. What are you thinking inside the pharmacy space? Not necessarily
Helping.
pharmacists, but in the pharmacy world that
Yeah,
doctors.
I mean, I think just being able to take new medications, like kind of walk through injections, right? That's one right there. Another one in terms of just like the working, like having technicians have it on, and then kind of showing them like how do you make this medication, like physically having them draw up instead of like wasting chemotherapy, or having them be like having them literally interact with the IV room in a virtual environment or in an AR environment where they're in the physical IV room and there's no physical drug there, but hey, the drug is here, grab it, put the device on it, the closed system device on it, like this. Okay, draw out this much, are you drawing out the right amount? Are you using the proper technique? Are you blocking airflow with the way you're holding the medications? So I think that's, in terms of training, going back to training and education.
Yeah, I mean, gowning, garbing, scrubbing, cleaning, all the things related to clean room kind of components, they come to mind, I think, pretty immediately. And the exact same thing for my nursing staff that I've worked with. Just how do you draw up a dose? How do you work with different syringe sets? How do you work with different IV sets? How do you work with a new pump that you haven't utilized before? Like all of those pieces to be able to showcase it either in virtual reality or augmented. All right, buddy. Next one is Patients can describe their symptoms better through augmented reality. The interesting piece there is like, I've got pain, right? You're on a televisit. I've got pain somewhere. Now you can kind of showcase like it is here, radiating from here to here, and then give some scales like where the pain is greater or lesser, for those individuals. I mean, I think that already directly applies, right? Quite well.
Yeah.
Like it translates
Yeah.
directly to the pharmacy. Like I have a rash in this kind of region. Like what does it look like? All of those pieces can be defined. And then the one thing that I saw was some cool technology, which I'm super old. So it was like 7 years ago, cool technology. But it used to define like the borders of wounds, right?
Hmm.
What the borders of the wounds look like, the redness, like if it is healing or not healing, size, etc. And so I think once again, this is a direct kind of application of what does it look like? How can you translate that better to healthcare providers to be able to help you with it? All right, the next one is, well, this is going to translate well too. Nurses can find veins easier with augmented reality. Same thing for us. I mean, just where are you going to place that vaccine, right? Where are you going to place that shot on the shoulder? How are you setting an individual
Yeah.
up for success? Oh, here we go. It's a fun one. I like this. Motivating runners through zombies.
I mean, I think that can be used I mean, I think the I hate this word, but the gamification of healthcare is more possible with VR and AR than it is like with anything else because it's an immersion, like you're immersed in it. Because the reason why people like playing sports is because they're immersed in it. They're like doing an activity, they're physically doing it, right? So, but not everyone is able to do those kind of things. So, maybe you can make somebody feel like, hey, man, if you just got a little bit healthier, this is what running would feel like, or this is what, just giving them the sensation of just doing something that they might not be able to do right now, and then that might motivate them to move forward. Or in this case, like hey, just gamifying it, like hey, every time you go to the gym or whatever, like there's one less zombie chasing you or something. I don't know, but
I like
like just life will get easier, but you have to work hard first, right? Just philosophy right now.
I mean, the behavioral economic stuff I totally appreciate. Maybe the gamification should include real money, which some studies are showing 50 to
Yeah.
$100 is the range. But I do think, let's say someone is doing it for adherence or someone's doing it for, like you're saying, physical therapy. If you show that your arm moved just a percentage further and you could have a coin pop up or something else show you like, hey, you made it this much farther with this, or you did the one more rep you're supposed to do, or you opened up the pill box and you took your medications for that day. Like those things having some kind of responsiveness to them, I think could be huge. The other ones, related to like the zombie principle of like something's, chasing you or trying to motivate you to be able to move forward. I think there's some negative like components too that we could use, like carrot and stick kind of mentality pieces. For me, I'm very much so a carrot individual, but the stick piece does work. So if all of a sudden you showed like consequences of not taking certain medications, and then you could display that on an individual, like, hey, your life force or whatever is going away, like you're seeing on a lot of algorithms based on wearables, like they're showing how well you're doing with your sleep overall, and they show your sleep scores and percentages. Having those diminish down and showing a more tired Kevin because he didn't take care of his sleep hygiene, I think can be other things that VR AR can take care of. I've only got one more here for you, bud, and it's all related to medical education. So, like when you're going through pharmacy school, what would you have enjoyed to be able to do? Because I had the Sim Man. Did you have Sim Man too?
No, I don't think so.
So we had like a dummy that was
No.
smart, that would have like different things that we could use with it. And I always thought, man, if the Sim Man could have been related to like virtual reality or augmented reality, so I could have practiced at home related to CPR or different trainings or physical assessments, would have been really useful. But other things that you can think of that would have been, a game changer for you to be able to make you a better clinician from that point to today.
Yeah, I mean, running through a code as a student, right? Like physically taking the action, going from your station, running to the emergency room, and then have all these other people around, and just like that heightened sense of, because until you at one of those things, you don't really realize it. And the first time shouldn't be like when you're a pharmacist. It's like just little things like experiencing things like that. Having the crash card, having to like open the lock on the crash card, like holy crap, what is it? I can't remember right now, right? Uh, you know, busting open the epis and stick them together, or you don't have the quick ones. You got to like do the calculations and have the bag of NS and just guys, it's just, yeah, I do not miss those days right now. But Kevin knows exactly what I'm talking about. You're like sweating when you don't have those quick EpiPens. You're like, oh god.
Kevin moves a bunch of ice.
Hey, I need somebody else down here.
I know, that's so funny.
But yeah, outside of like, like the obviously like patient cases and things like that, I think going through experiences, right, like that, or and it sucks, but like maybe going through like a hostile experience, like when you walk into a room and the patient is between you and the room, yeah, we can talk about it, like, oh, when this happens, just make sure you stay against the wall or do this or scream really loud, but like putting them in environments like that, and also like the good stuff, right, like physically going in, sitting down, logging on the computer, because typing on the computer, looking at the patient, typing on the computer, all that stuff takes practice, takes time, right? So just like going through like just generic everyday things that take us time to learn, but I think would be great to experience in school.
I love it. I love the bedside manner one that you just mentioned right there. Like, how do you keep eye contact? How do you engage with the patient? Like all of those pieces, if virtual reality can help you with that environment and tell you how you were doing with your eye movements and just level of contact and confidence and everything else coming across, like there's tons of utilizations there, I think, inside of those settings. So we can get better at serving our patients and probably better at educating our patients too. I think that's the one thing that I would have loved, is the ability to go, here's this new drug on the market. Here's the theoretical mechanism of action, like in the way it's working. Like here's how to think about how these drugs are working, so that now you can bring that same level of in-depth understanding to your patients on obviously a much simpler level to be able to educate them. And so I think some of those things in pharmacy school would have been fantastic. And right now, I mean, I was just talking the other day, Zane, to a young pharmacist and saying, I had a peripheral brain basically after I graduated. Still, I wasn't memorizing everything. I didn't carry 20 books when I was at the hospital. I just had one little thing, and it was called a phone, and it had everything I needed on there. And so I think being able to take that to an entire new level with augmented reality is another really exciting thing for a young clinician to become better and better at what they're doing, because the confidence level and the anxiety with doing something new, but you can get through that because now you've experienced it and you've done it before, at least to an extent.
Yeah, we can walk through an example of like the perfect world for augmented reality from the pharmacist standpoint, right? Like you're at rounds and you're looking at the patient, the demographics are up, and then the doctor's like, hey, the doctor asks you what medication is used for this disease state or whatever, and you can just look straight at them and be like, for this, and it's just like, whatever, I can't think of the source right now, but your antibiogram shows up, all that stuff is up there, and you can just be like, no, it's this one, right? And you're not in your computer, buried in your computer looking at them, you're just looking straight at the provider. Or a patient comes and asks you, hey, what is the side effect for this? We can't remember every single thing, right? And you can be like, hey, yeah, and the AR is reading all of this and it's saying side effect for this, and those things are just showing up on your glasses, and you can just like start rattling it off and be like, hey, hypertension, and you can just say, oh, your high blood pressure. Like you still need the other person to kind of like talk to the level of the patient, right? Because you're just taking the information that already exists from the medical side, and it's, you obviously should be able to understand that, but you are able to translate that to them. Like those kind of things, I think it'll help. I think AR can help us stay in the moment better than with the way we are right now. Like, we're not turning away to write on a computer or anything like that. It can transcribe for us. It can do all these things for us. It can show us in the moment, in our field of view, what's going on, right? It can, even when you walk into a room, maybe it can just tell you the patient's name right there, right? You might not have had a chance to look the patient's name up, right? And you can just go in and be like, oh, this is Martha Stewart. It's me, like just like little things like that are like, that are helpful, I think, to connect with your patients and really help them feel like you really care about them.
Yeah, I love it. I mean, I think you can go on, thankfully, both sides of the table for both the patient and for the clinicians to be able to leverage inside of space. We've got a ton of ways to go from our current kind of statuses of what I think can, like you're saying, be really good content delivery and probably a like educational delivery at this current stage, to something that's more aesthetically appealing and probably just more versatile and utilitarian that we can wear often and then be able to leverage in our job settings. But lots of cool things coming along the lines. I think lots of ways that we can augment our current working like conditions to be able to help. some technologies that are already out there and rolling. So I'm really excited to see the next steps in this, Zane. And I'm sure you and I will be talking about it again really soon. Anybody have any questions? You let Zane and I know. Head over to Digital Thoughts and make sure you're consuming all of his awesome stuff. Head over to RPH Ally and check out Zane's channel there and join the conversation on that. Zane and I are planning. We've got a lot of things in the works, but in July, we are planning a get together with the pharmacy world. So stay tuned to get together with us there, and we will talk to you guys next time. Zane, love your hat, man, and still love your beard.
Go Bulls, even though they suck. But hey, that's what being a fan's about.
All right, guys, have a good one.